My name is Shelley McKittrick and I'm the Homelessness Program Director for the City of Aurora. In 2016, our City Council designated $1.5 million a year for 3 years of marijuana tax revenue to address homelessness in our community. In order to oversee that funding and work with the community, they decided to create a new position. So I'm filling that position, and since the time I've started, City Council has actually worked with our local marijuana retail shops to increase our local tax 2% so that we have an ongoing dedicated funding stream to help to reduce and end homelessness. I'm really proud to work for the City of Aurora, where they have taken this very vital issue of folks who are living with housing instability and homelessness and really put some money and expertise behind the plan to address these issues for our most vulnerable citizens. Experiencing homelessness is a tough situation throughout the year, but when the temperatures drop in our Rocky Mountain region, folks experiencing homelessness can actually be at risk of hypothermia and death. Several years ago in the City of Aurora, one of our residents died on the street as a result of exposure, and the city's response was to develop the ACOT team. ACOT stands for Aurora Community Outreach Team, and it consists of a team of 2 police officers, a licensed medical provider, a licensed mental health provider, and an outreach worker who take time out of their own schedules to meet at the van at 6 p.m. on nights that the temperature is forecast to drop below 20, and they go out around the community looking for folks who are outside on extremely cold nights. Once they find folks, they stop, they talk with them, they offer them rides to shelter or other places they can be inside. If the individual doesn't want to come in, then they give them cold weather supplies to be able to survive the cold weather better. This program has been a real benefit to the entire continuum of homeless services in the City of Aurora. And for cold weather events, we also do things like activate our homeless shelter, the Comitis Crisis Center, so that they take in more people than they do on regular nights. And Aurora Warms the Night offers motel vouchers to those who just can't sleep in a dormitory setting because of trauma or mental health issues, or not being able to be separated from their family members or pets. So the ACOT team is a piece of our cold weather response and a piece of our entire system that we're working on to reduce and end homelessness in our city and our region.
Hello, I'm Kenneth Forrest, and in addition to my role as a police information officer, I also work as a member of our ACOT team. I've been privileged to be part of ACOT for over the past 3 years, and it's a wonderful program where we really get out there and help the community. And so our participation as the police department is we work with a mental health clinician, a health professional, and also an outreach worker. And we go out to all these areas of Aurora and contact people who are in need. Sometimes they just want a blanket or a snack. Other times, they might need medical attention or even maybe some mental health, help. So our goal for the community is to really help them. We've developed really good relationships with the community where people really trust us. And our job as police officers is to keep everybody safe, make sure all the people who are on the bus with us, the clinician, the mental health worker, and the advocate are safe, and that we can then provide these necessary opportunities. So the ACOT van has been a fixture of the community for the past couple of years. We were able to put this nice wrap on it roughly 3 years ago. And it has a lot of our partners with MCPN and Colfax Community Network, PATH, Aurora Warms the Night. And we'll pull up and people will actually run to us because they know what ACOT is. They know what we're there for. We're there to help them out. And they'll come up and they'll ask us, hey, do you have some clothes? Do you have some socks? Do you have hand warmers that you could provide us? So let's head on to the bus. We can kind of show you what we have. So when we go out on the bus, it is driven by a police officer, and then everybody else sits in the bus. And then as we go to certain areas, what we do is we'll bring people on the bus, or actually if they don't feel comfortable, we'll actually bring items to them. We'll ask them if they need any food, if they need transport, if they say they're good for the night but they would like something to eat, or they have blankets that we could maybe provide. So we have meals ready to eat that we received. This bus actually is an old RTD access a ride that we received from RTD. So we have food, we have clothing, jackets, we have lots of hats and gloves. A lot of these items are hand knitted by people in the community. So they knit these items for us. We have emergency blankets.
Resource guides so that people can get connected to the services they need after the cold snap.
And we also have hygiene kits that we provide. We have hand warmers. We bring food items, little snacks. It could be power bars, things to nourish them, keep them warm during the night if they do not request to go to shelter.
One of the things that makes ACOT so successful and such a unique intervention is that it is our community providers, our partners in addressing homelessness, that are on the van with the Aurora Police Department. Our providers from Metro Community Providers Network, Aurora Mental Health Center, Mile High Behavioral Health Care, Colfax Community Network, they all work together to be able to make these contacts during a cold weather crisis. But what's really important is that first touch or the second touch through this kind of outreach can be the relationship builder that actually brings people in for services so that they can be working toward ending their homelessness. So although it's an emergency intervention during cold weather events, there's a long-lasting impact on the relationship between our Aurora Police Department and the homeless community, as well as our providers who are also out on the street on a daily basis, and then the person can say, hey, I remember you from that really cold night and you helped me out. And that is a relationship builder that can actually change a person's future.